Gastroesophageal reflux disease, Gerd, is a condition wherein stomach acid flows back into the esophagus, moving towards the mouth. This occurs due to the weakening of the gastroesophageal sphincter, a valve that separates the stomach and esophagus. Gerd affects approximately 20% of the population. The presence of stomach acid in the esophagus leads to symptoms such as heartburn, difficulty swallowing, chest pain, and a sensation that food or liquid is regurgitating into the throat. This backward flow is termed regurgitation. Heartburn typically worsens after eating and at night, while chest pain is more pronounced when lying down. In rare cases, the acid can reach the mouth, resulting in a bitter taste, coughing, hoarseness, and enamel erosion on the teeth. The top 5 causes of gastroesophageal reflux disease include dysfunction of the lower esophageal sphincter, hiatal hernia, obesity, pregnancy, and the consumption of alcohol, smoking, and caffeine. A hiatal hernia occurs when a portion of the stomach bulges into the diaphragm, typically meant to separate the abdominal cavity from the chest cavity. This bulging leads to increased pressure in the stomach, weakening the esophageal sphincter and allowing acid to flow into the esophagus, thus causing Gerd symptoms. Therefore, Gerd and hiatal hernia often share symptoms, as hiatal hernia can be a cause of Gerd. The primary causes of hiatal hernia include obesity, physical strain such as intense exercise or lifting heavy objects, pregnancy, aging, and smoking. The main risks associated with both conditions are esophageal inflammation and ulcers. Prolonged disease present significantly increases the risk of esophageal cancer by about 10 times or more. Diagnosis of Gerd relies on signs and symptoms. Endoscopy is utilized to observe inflammation in the stomach and esophagus. A barium swallow X-ray helps determine the shape and function of the esophagus, while manometry may be used to measure the strength of the esophageal sphincter. Additionally, pH levels in the esophagus can be monitored ambulatorily to assess acid reflux severity. The treatment for gastroesophageal reflux disease, Gerd, and hiatal hernia primarily focuses on lifestyle modifications and medications to manage symptoms and prevent exacerbation. Here are detailed approaches to treatment. Avoid trigger foods. Both conditions benefit from avoiding foods that can trigger symptoms. These include spicy foods, citrus fruits, chocolate, caffeine, and alcohol. Meal management. Avoiding large meals can help prevent acid reflux and the exacerbation of a hiatal hernia. Smaller, more frequent meals are recommended. Elevating the head during sleep. Using a wedge pillow or raising the head of the bed by 6 to 8 inches can help prevent nighttime reflux by utilizing gravity to keep stomach contents from coming back up into the esophagus. Weight loss. Reducing body weight can decrease abdominal pressure, which in turn reduces the likelihood of reflux and the worsening of a hiatal hernia. Antacids. Over-the-counter antacids, such as Malox and Mylanta, can provide short-term relief by neutralizing stomach acid. H2 blockers. Medications like ranitidine, famotidine, and cimetidine can reduce acid production and are used for a duration ranging from several weeks to months, depending on the severity of the condition. Proton pump inhibitors, PPIs. Drugs such as omeprazole, esomeprazole, and lansoprazole are used for long-term reduction of acid production. They are typically prescribed for an initial period of 4 to 8 weeks, with further treatment depending on the patient's response. It's important to note that PPIs can have side effects, including dry mouth, as they may also affect saliva production. Surgery and endoscopic procedures. In severe cases where conservative treatments fail, surgical or endoscopic interventions might be necessary to repair the hiatal hernia or strengthen the esophageal sphincter. Post-meal management. It is advisable to avoid lying down for at least 3 hours after eating to prevent reflux. Chewing sugar-free gum. This can stimulate saliva production, which helps neutralize stomach acid. Herbal teas, ginger tea and chamomile tea can reduce inflammation and alleviate Gerd symptoms. Alkaline foods. Consuming non-citrus fruits and vegetables may have an alkalizing effect on the stomach, which can help reduce acidity. Baking soda solution: a half teaspoon of baking soda in a glass of water can provide temporary relief from heartburn. However, this should not be used long-term due to potential side effects such as increased blood pressure or fluid retention. Sleep position: sleeping on the left side can benefit individuals with Gerd, as this position naturally places the stomach below the esophagus, making it more difficult for stomach acid to flow back into the esophagus.